Time out of your busy day to attend this webinar, What's Happening with Housing. My name is Emily Bean, and I manage the MaineCare HIV Waiver Program. As you may know, we facilitated this similar webinar in 2023, and we had a good response, and housing continues to be an urgent need. So we invited the Maine State Housing Authority and the MaineCare Home Program to do this webinar again. The goal of the webinar is to inform community providers about some of the general housing programs and resources available in Maine. We hope to have times at the end for questions, but please feel free to type anything into the Q&A or chat section, and Linda and I will try to monitor those as we go. If we can't get to all the questions at the end, we will type up some formal answers and post that as well as a recording to this webinar and our provider resource directory on our webpage and email them to those folks in attendance. Joining me today, I have two speakers, Mike Shaughnessy, who is the Homeless Initiatives Program Coordinator with the Maine State Housing Authority, and Angelica Booker, Provider Relations Specialist with the MaineCare Delivery System Reform Unit, who will talk briefly about the MaineCare Housing Outreach and Member Engagement, or HOME program. There will be one quick poll question at the end, so please don't disappear too quickly as we conclude. And once again, thank you all for joining. I will give the floor to Mike.
Thank you very much. So as I was introduced, my name is Mike Shaughnessy. I work at Maine Housing. I work in the Homeless Initiatives Department. I deal mostly with people experiencing homelessness or people who are at risk of experiencing homelessness here in Maine. And I'm going to talk briefly about what our homeless response system looks like currently. If you were at last year's seminar, a lot of this will be similar. There are some new programs. There are some that are a little bit revised, but our system does look similar to what it did last year. And I will try to be as brief as possible. I may ramble a little bit, and I apologize for that. So starting with homelessness, it pays to know what homelessness is. And it's important to recognize that most programs, housing programs, use HUD definitions because there's HUD funding in it. That's Housing and Urban Development, the federal agency that funds housing and homelessness here in the United States. So when we're looking at, who is eligible for a program that serves people experiencing homelessness, generally we're looking at people who are in a place not meant for human habitation. They're living in a car, they're living in a tent, they're living in an encampment, that type of thing, in an abandoned building. Or they're actively fleeing a domestic violence situation or attempting to flee a domestic violence situation. That has been, the definition for that has been revised a little bit. Someone does not have to leave their primary nighttime residence before receiving assistance under this definition. So if they are trying to get out and haven't left yet, they're still eligible for assistance primarily through our domestic violence resource centers across the state. Other situations like couch surfing and overcrowded shared housing doesn't qualify under a lot of the HUD-funded programs. I know some other programs will serve those, but most of our programs don't. There is one exception to that, though, and I will note it as we go along. So jumping in, starting at a state level, we have two primary organizing bodies for homeless services here in Maine. One is the Statewide Homeless Council. It's appointed by the governor and by the legislature. It's an advisory body and an advocacy body to our legislature and to our governor's office. The membership is appointed, and they have quarterly open meetings. They meet monthly as a council, and then quarterly they have an open meeting where anyone can attend. And those are on our mainehomelessplanning.com or .org website. You can find those meetings. The Maine Continuum of Care is a similar body. It's a statewide body. It's mandated by HUD, and its primary function is to provide housing programs with funding. And yes, Linda has these slides, and she will share them. They provide funding to housing programs. Those are open meetings every month on the second Thursday of the month. Anyone is more than welcome to attend and participate. anyone who is interested in the topic and is a stakeholder, and you all are stakeholders working with people who are experiencing homelessness and at risk. So moving down a level, we have in Maine, we have what are called homeless service hubs, recognizing that each part of our state is different from one another. Portland is different than Kittery. Kittery is different than Fort Kent. So recognizing the differences within our state and recognizing that we are a sparsely populated state, rather than keeping everything at a statewide level, we have divvied the state up into service hubs, which are similar to the public health districts, same concept. So it's based on where the services are, where people are traveling to get services from where they're coming from. They meet, providers in the hubs meet regularly to coordinate care. They meet regularly to operate the coordinated entry system, which is what Shelter Plus Care, when it is open, runs through. There are some other programs that run through it as well. There's a designated coordinator in each hub, and their job is to convene meetings, to coordinate, to collate data, and keep the hub cohesive and working towards the same goal, which is to end and prevent homelessness. And healthcare providers, you are welcome at your hub meetings. This is a map of our hubs. We have 9 of them. York, Cumberland, we have Midcoast, which is those, those smaller Midcoast counties. It also includes the towns of Brunswick and Harpswell. Hub 4 is Androscoggin, most of Androscoggin County. Hub 5 is Oxford and Franklin County, plus the towns of Livermore and Livermore Falls. Hub 6 is Kennebec and Somerset County, our central Maine hub. Hub 7, Penquist, Penobscot, and Piscataquist. Our down east is Hancock and Washington counties, and Hub 9 is the county, Aroostook. So whatever area you're in, you are covered by a hub. You see blank spots on the map. That's just where nobody lives. These are all the populated areas in the state and where they are served through.
Some people live here.
So going to more local, we have homeless service agencies throughout the state that we partner with at Maine Housing. A lot of them have, most of them have shelters, but they do more than just provide shelter. They provide housing navigation, both for people in their shelter. Some of them provide for people who are unsheltered, and also for people who have been housed out of the shelter.
How are you? How are you? Good. How are you? How are you liking it this
someone
week?
unmuted.
Oh, you mean have a screen?
Oh, are you in screen?
So we also have a few of them that provide rapid rehousing services, which I'll explain, and then our housing problem solving initiative, which most of our funded agencies participate in as well. So let me delve into that a little bit. This is a map. It's very small. You're not going to be able to see it. It is in the slide that just shows all of the agencies across the state that we partner with. We have, and actually it's in the next slide. And for 2024, we have a couple new programs. This is in addition to the ones that have been in the ESHAP program for longer. Common Space, formerly known as Amistad, is now providing navigation in Portland and out of Wiscasset for Lincoln County. Waldo Community Action Program is providing navigation services in Waldo County out of Belfast. And then we have a new shelter in Augusta, Sisters in Arms Center. It's a 10-bed shelter for female veterans. It's the only female veterans shelter in the state. And that's in addition to everything on the map, which you will get in the slides. You can also find it here on mainhousing.org. This includes everyone that we participate with and fund, as well as the non-federally funded shelters in the state. And it's noted which is which. And it's broken down by what demographics they serve: adult, family, youth, domestic violence. Those shelters that are funded through Maine Housing will have a level of standardized service delivery. Those that aren't funded, they are free to do their own thing. So I can't speak as to exactly what they do offer and what their entrance requirements would be.
Mike, I just wanted to mention to the group here, I have
all of these listed in our housing resource directory, and you can go in and select your county, or you can go in and select the type of person that you're looking to help, and it'll bring all of this information up. Thanks.
So housing navigation, housing navigators are located at all of our ESHAP agencies. That's Emergency Shelter and Housing Assistance Program. That's our funding vehicle for homeless service agencies. Housing navigators will work with people who are in homeless situations, whether it be in shelter or unsheltered, depending on caseload, in order to help them locate housing, do applications, get them through the lease up process. And then they work with them for a year after getting housed to maintain their stability so that they don't return to homelessness after a brief stint of being housed. So as it says, they provide support both before and after, and they're able to work with people who aren't in the shelter if they have available space on their caseload. And that's obviously dependent on the capacity of each individual agency. Rapid rehousing. We have 6 programs for rapid rehousing throughout the state. This is a more intensive program than just our navigation program. It provides that same type of housing location and stabilization that our navigation program does, but it also provides further supports such as it can provide funding for rental arrears, utility arrears, for housing application fees, for there's even a landlord incentive. So we all know that finding housing right now is extremely difficult, especially affordable housing. This program provides a cash incentive for a landlord to lease to a program participant. And that has been a big help in getting people housed through these programs. So you see where they're located, all the way from York County up to Aroostook. They're not everywhere, but they do cover a lot of the population in the state. Our housing problem solving initiative is one that's a little bit different than the other. There are no rapid rehousing. I just saw the question come up. There are no rapid rehousing programs in Penobscot or Penquist. We had one in Bangor in the earlier stages of the pandemic. This originated from pandemic funding, but it wasn't renewed in the recurring grant year. The agency was not able to continue with it. So unfortunately, we've tried to cover as much as we can. We don't always cover every base because we have to partner with agencies to get those on the ground. Housing problem solving, it's embedded in most of our agencies. And it's less of a program and more of an approach. It's based on those critical conversations that happen when someone is about to enter homelessness or has just recently entered homelessness. So it's really at that transition point that this program comes into place. And it's based on the conversation, trying to find creative solutions to their housing crisis, and can provide some small scale flexible funding if there's something minor that would help them not fall into homelessness or get them back housed quickly. This is our one program that can work with people prior to entering homelessness. So if there's someone who's at risk, who's couch surfing, who's being evicted, who's being foreclosed upon, this is one program that we at Maine Housing have that can help them in that instance. So we also have a navigator pilot. It is winding down. I'm not sure if it'll be renewed or not. But there are a number of agencies in the state, and essentially it was to bolster the navigation capacity so that the entire state was not relying on ESHAP programs to get housing navigation. So this is just an additional navigation resource, and obviously none of these agencies have shelters, so they're all working with unsheltered individuals. And again, all the way from Aroostook down to York County. This is a new one. It's called HOPE, Housing Opportunities for People in Encampments. It's starting as a pilot program in Portland. It's a partnership between Maine Housing and the city of Portland. And it's taking those navigation services and moving them further upstream from the shelter facilities themselves. It's actually trying to provide housing navigation to people in encampments. Those people who can't get into the shelter or are unwilling to go to the shelter, still giving them resources to get them housed. We have outreach providers out there. That's a different base of expertise. So we've created this hybrid street outreach and rapid rehousing program. This has just come off the presses. I actually added this slide right before I sent it to Linda because we just got the first steps in it. We're going to be launching it this spring. The hope is that it will be successful. If it is successful, we may try to duplicate this in other places across the state. But it's being run by the city of Portland in partnership with Preble Street, Milestone, and Common Space. So if you have individuals who are in encampments in Portland, they may be able to find assistance through this. The other outreach source in the state is PATH. So it's a DHHS program. You may have heard of it. But it's for people experiencing unsheltered homelessness with a serious persistent mental health diagnosis. And there are PATH providers throughout the state. In certain parts of the state, as we know, hiring is difficult. So there is coverage, but it's not robust in every part of the state. But if you have someone who is unsheltered and has a mental health diagnosis, it may be worth reaching out to some of these resources to see if you can get them connected. And they can connect to resources such as Shelter Plus Care when it is open. I will acknowledge that our Shelter Plus Care system right now does not have open applications. And we all know that the BRAP system has limited their intakes, which has really cut down on the number of resources available. I will acknowledge that elephant in the room. And I did get a couple questions about what's there to replace it. And I wish there was, an easy answer to that. We're trying to cobble together things. We do have a system that is very overwhelmed right now, unfortunately. So that is the last slide I have. I know it says questions, but I will hand it off to the next presenter and we can do questions at the end, I think.
That sounds good. Thank you, Mike.
Great, thank you. My name is Angelica Booker. I work at the Office of Main Care Services for the Delivery System Reform Unit. I specifically help providers with the Housing Outreach and Member Engagement Program, as well as our community care teams. All right, just trying to figure out how to get it on the right.
It looks good, Angelica, on my end.
It looks good? Okay,
Yep.
Perfect. Okay, so yes, I work for Main Care Home Program. I also do the Behavioral Health Home Program, as well as our traditional community care team. What I wanted to go over quickly with you today was just an overview of the home program, talking about the different health home model of service. It is a national model that we follow, that home is part of. What is required to be a member of the home program, how you can become eligible for that, as well as the different organizations that we now have as home providers. So as I said, the health home model of service is a national service. It's a Medicaid health home service model. What it geared towards is making sure that people are getting whole person comprehensive care management, which includes team-based care coordination, team-based supports, health promotion services like smoking cessation, grow your own food. Health promotion can be a broad range of things. A person-centered plan of care and comprehensive transitional care services as needed, as well as following up on things like referrals for the members. All of our health home programs include comprehensive case management, care coordination, health promotion, comprehensive transitional care, individual and family support, because we do recognize that families need to be included in many services, as well as referrals to community and social support services. To be eligible for the home program, the first thing is you do have to be a member of Main Care. So if you are a Main Care member with full Main Care services, that would be your first step to eligibility. Once you're eligible through Main Care, you have to be diagnosed with either 2 chronic conditions, eligible chronic conditions, which we'll go over on the next slide, or one chronic condition and be at risk for another one. And for the home program, you also have to be experiencing long-term homelessness. For our purposes, the definition is listed here, and I will make sure that Linda sends out these slides so that you can read it more thoroughly. But it does mean that you are residing in a place that's not meant for human habitation, an emergency shelter, a temporary outdoor shelter, a homeless shelter, or a setting of institutional care or incarceration for a minimum total of 180 days out of either the last 365 days or 2 of the last 3 365-day periods. And there are some other things in the definition here. I will say that I know that one of the questions that has come up is, what about things like couch surfing? And is that considered homelessness in our definition? And it is. If you're couch surfing, or the person is staying with family members but isn't on the lease, isn't paying rent, then that would certainly be considered homeless for our definition of it. Eligible conditions for the eligible chronic conditions are listed here for the folks that are on the phone. It's a mental health condition, a substance use disorder, tobacco use, diabetes, heart disease, obesity, chronic obstructive pulmonary disease, hypertension, hyperlipidemia, developmental intellectual disorders, circulatory congenital abnormalities, asthma, acquired brain injury, seizure disorder, and HIV/AIDS. So those are the ones where I said you have to have 2 eligible chronic conditions, or one be at risk for another. So if you have somebody or yourself are experiencing these conditions, are also experiencing long-term homelessness, then those would fit into this. The eligible risk factors for that second condition can also be poor nutrition, childhood trauma, risky sex practices, intravenous drug use, history of incarceration, history of current substance use, or family history or genetic predisposition for developing a chronic condition. So even though you look at the list and you say, oh, well, how would somebody fit into that? Some of them are definitely a little broader when you look at it, especially for the homeless population. Sometimes history of incarceration would certainly fit it. Sometimes substance use, also the family history or trauma. A lot of people can fit into these categories. The different organizations are currently providing home. We currently have 5 providers. We have Androscoggin Home Health Care and Hospice Services out of Lewiston. They're serving Androscoggin, Kennebec, Franklin, Oxford, Cumberland, York, Piscataquis, Penobscot, and Saginaw counties currently. Common Space out of Portland is serving Cumberland County. Milestone out of Portland is serving Cumberland County. Penobscot Community Health Center is serving Penobscot and Waldo counties. And Preble Street out of Portland is also serving Cumberland County. We are looking at a couple other agencies who are looking to come on board. So I'm hoping to expand this list soon. If you are a provider and are interested in becoming a home provider, I would love to talk to you. My information is right here. And I will also post the website for the home program that has our application, our one-pager, and a bunch of other information.
Great, thank you, Angelica. I know we've had a few questions come into the chat. Is there anybody that wants to come off mute and ask any other questions?
If it's okay, Emily, I'll launch the poll.
Yeah, thank you, Mike and Angelica. As I mentioned, we will post and send out to everyone registered for this training the slides. Please take a second to answer this poll question. And Linda is also going to add a link in the chat to a really quick, like 1.5 minute survey for SurveyMonkey. So before you get out of the meeting, we'll leave it open for a few minutes. If you could also do the SurveyMonkey, that will help us get feedback for our future trainings.
Thank you. Could I ask a quick question, or is it too late?
No, of course.
No, go
Um,
ahead.
I received a call. I work for ODES, for folks with developmental disabilities, but I often get referrals just from the community because I've been around for a long time, people know of me. So I got a call the other day from a woman who was living in a hotel with her kids, and she had like one more day that she could pay for the hotel. And, I tried to pull together some ideas for her, but kind of like down and dirty. Where should I kind of, where should what information should I have given her, for referral stuff? I mean, I used 211, just different things I gave her, but it just felt very unorganized and not real helpful.
Well, it depends on what part of the state you're in.
Well, she was in Bangor area.
So in Bangor, your primary referral sources would be City of Bangor, GA.
I did that. Good.
Bangor Area Homeless Shelter, and
I didn't think of that.
yeah, Bangor Area and PCHC Hope House would be your three major.
Okay.
Sorry, my dog's
Even
moving
with
around in the background.
children? I mean, she was a mother with children.
So they may be able to provide resources beyond just shelter. Like I said, they can provide navigation services.
I guess they had food stamps. That's the one thing they had.
The other resource available is if the household is fleeing domestic violence, then Partners for Peace is also a resource in the area.
Thank you.
Mike, we got a question in the chat about housing resources specifically for pregnant people. Do you have any information on that?
I do not have something specific. I know this is one of those things where I heard about it in passing, but I don't want to say anything definitive, that there was a program that was trying to get off the ground, but I don't have any specific information on it.
Let me check. Let me check the housing directory here.
Angelica, I think that last question that just came into chat might be for you because they're asking about the conditions listed. Do you want to take a look at that?
Yeah, I did. We really only deal with main care members that are eligible for our program. So I wouldn't be able to answer what other resources are out there for them.
And as far as someone who is experiencing homelessness, your first resource is probably going to be those service agencies that are mostly shelter agencies, as well as it could be PATH. Well, if you said don't fit the requirements, so PATH does have requirements. So your best option would be to contact local shelter agencies. And the other question is, so is the state building any additional housing across the state for citizens? Yes, we have grown our development of affordable housing at Maine Housing from approximately 200 units a year before the pandemic. Now we are over 1,000 units a year that we are trying to field and get through the pipeline. It does take a while. We're talking about building buildings or rehabbing old buildings, so it's not an instant fix. And we also are facing a 66,000 unit shortage of housing in the state. So we have amped up our production of housing, but it is, it's hard to get over 66,000 shortfall. And I will mention, you hear about, is this going to the asylum seeker population? Yes, we are helping the asylum seeker population. It is less than 3% of our funding for housing that is going to that. 97% of our housing is going to housing resources that are directed towards U.S. citizens or people with a legal permanent status.
Great, thank you. We have about 1 more minute left. Just a reminder that I'm going to actually put the link to the SurveyMonkey survey in again because it kind of got bumped here.
Do you have it?
Yes, I just copied it, Linda. Thank you. So we'll stop the recording here in a second. And before you leave, if you wouldn't mind grabbing that link to that quick SurveyMonkey. Anything else I'm forgetting, Linda?
I think we're good. I just put up an answer to someone's question that they might find the provider resource directory that's currently posted. An updated version of it will be posted next week along with recording of this webinar.
Thank you everyone for coming today. And thank you, Mike and Angelica.
Thank you for having me.